what is one cool idea that you learned in this conference by being here?
Well, I really appreciated the presentation on psilocybin for cocaine use, and particularly the quality of the participants' experiences in terms of representation for people who come from a Christian background. We hear a lot of more we hear Buddhist themes often, so that was interesting to also have that perspective, and also the participants from that study and their racial and ethnic background. It's nice to see that with the psychedelic work, there's greater representation and diverse views, and I thought that was really important.
Monica Williams flashed some numbers on the board, and I always knew that there were gross inequalities between people of color and white people in terms of their health or their infant mortality or their how much money they have, but like those numbers were very stark and really kind of made me drop my jaw.
For me, and it's a theme that came up in a lot of talks, is making social justice part of the psychedelic research and community.
Well, I guess for me, it's just the balance that the conference has in 2 days, in which yesterday we had something more related to science, and today something more related to a broader aspect of the use of these substances. And it always brings up new challenges, new questions. So yeah, thank you for all the presentations that we have. It was very inspiring, and I did learn a lot. So thank you for, yeah.
I'm going to piggyback on your comment. I agree that the diversity of even not just the audience diversity is amazing, but it's also nice to have the diversity even on the panel between the women and the men, and also with just the array of research that we're actually doing is pretty amazing.
And also the production of the whole thing was just amazing, so congratulations.
I appreciate the fact that the organizers of this conference designated risk reduction activists to care for us while we were here, set aside space for that, and really support that topic.
I leave, I guess, what I learned the most about is this possibility of opening up new subjects and new topics in an open fashion, and how this is allowing for new possibilities of dialogue that clearly we need to talk more and resolve more. So.
I really appreciated learning about the ayahuasca legal defense project, because I think it is so important that indigenous people have access to their medicines and their traditions, and they're so often so disempowered, and it's so encouraging to see what's being done to protect that. So.
Yeah, JFK did LSD. Wow. I really appreciate it in terms of keeping spaces safe from sexual violence and assault. The detailed bullet points that Annie put forth. Like we actually need to employ a strategy, and so it's always like, oh, we want to do this, but to have that like bullet point, you know, going down a list was amazing, and so I can't wait to go back and look at that online.
I really appreciated the talk about peyote, and I feel like I learned so much, and I really appreciated getting like a really clear idea of what's happening, and getting a really clear message, and that I'm looking forward to sharing with people, is that peyote is for Indigenous people, and just really reinforcing that. Thank you.
And what about one aspect that you would like to suggest for future editions? What is missing, or how can we improve for next editions of this annual conference, for the 13th edition and onwards?
I was very moved by the film that was shown in the last presentation, and I would like to see time set aside for reshowings of films by artists working in this community after the presentation of the talks, a film night, for example?
Yeah, and I think even more indigenous voices would be good to achieve.
I think that in the future, with this kind of research, I think it's important that as researchers, whether we're indigenous or non-indigenous, that we recognize the indigenous peoples for the medicine that they bring. I mean, we have a lot of, discussion about ayahuasca, but we don't have a lot of discussion about the original peoples that brought ayahuasca to the forefront, or when we talk about, these indigenous plants that we're giving credit to the the native plants that we're giving credit to the indigenous peoples that this began with, and that we're being cognizant of the potential for biopiracy that could be occurring with indigenous plants.
Well, I think that in this conference we have talked a lot about integrating different knowledges, and maybe there are ways that we can in fact put that into practice. I mean, have a real dialogue between the different traditions that use different substances. So open up the dialogue and not just say that the dialogue is important.
I have two very small practical things that have nothing to do with psychedelics for suggestions. One is I get the sense that people really want to connect with other people and know where they live and what they're doing, and if maybe on our name tag it could just say like the city that we're in or the town that we're in or something. I know the people in Canada have asked for that, so people want to be able to connect in real space, and so where we're located on the name tag I think would be helpful. And the other tiny thing is that we should have made an announcement for everybody to turn off their fucking cell phones before we start talking.
So I want to echo and amplify some of the things that were already said. Yeah, integrate different types of knowledge. Let's do this thing, right? We talk about it, but yeah, let's do it. And yeah, more voices, whether it's more perspectives, right? Whether it's indigenous or the different traditions or different scientific disciplines or, that.
I think I'd like to learn more about different models of organizational structures and funding structures, and explore potential alternatives to sort of the capitalist medicalization agenda, and just see different ideas presented as options.
I'd like to see more psychedelic communities of color and psychedelic organizations about people of color having a partnership role in developing this conference, and so not to just be invited, but to be part of the planners who make this happen.
Thank you. I would love to see rogue herbalists, people who talk about psychedelics and also like yarrow and all the other plants, and who use them for healing in their community, all those rogue herbalists out there.
I'd like to see the possibility of maybe expanding outside the sphere of psychedelics and the knowledge of psychedelics, and maybe how can we start connecting what we're learning here into other disciplines or forms of knowledge, such as meditation, dreaming, and so on.
I guess with self-interest, I'm going to promote a little bit more focus on psychedelic integration. Spoke to a number of people here in the audience who are doing that work or want to learn more about it, and I don't think that we've together as a group, as a community, has really identified what that exactly entails, what it means to be doing that work, learning from each other, there's no conference, there's no gathering for people who do that kind of work, and somebody who does psychedelic integration work, I think it's really important that we connect and do that in that way, so more focus on that would be great as well.
I want to ask you all if you can give a message to the funders and the philanthropists that are in the room. Will you have anything to say, or anything you want to ask for and that you need help? I want to ask Rick Doblin, that is talking there, to listen to the next round of comments? What the researchers in the field need and what message they have to give to funders and philanthropists that might be listening to us.
I was talking to somebody about this during the break. I really feel like, as a psychiatrist, that there's a real revolution happening where all of a sudden we've got a lot more tools at our disposal to help a lot more people, and they work better. And unfortunately, it takes money to sort of, bring this into the world and birth it and have a good life. And it is sort of like this, the train is leaving the station. Like, you got to get on the train. It's happening now. We're reaching critical mass, and it feels like a lot of things are coming together. And unfortunately, the engine needs coal, so people need money. But I don't. I'm fine, so don't worry about that.
Yeah, I think it will be great when this phase 3 is done of all these substances, and then there's a lot of revenue that will be made, and that all of that, or a good part of that, is put back into the more cultural and the other diversity of practices, so that they can also be accessible to people and the indigenous causes around it as well.
I'm interested in forming a psychedelic women's funding cooperative, teaching women how to raise money and inviting funders to match those funds. I am personally interested in raising some money to provide more training for community mediation and conflict resolution.
As Westerners, our psychedelic history can be kind of traced back to Gordon Wasson, going to Juanita Jimenez, and personally, I would love to channel some funding. We have some repairs to do from how we did that and how we went down there as hippies back in the 60s and 70s, and a lot of these old curanderas and curanderas have houses that need their plumbing fixed, and we need to attend to those people, not in a savior complex way, but just I would like to see some attention going down to the Mazatec people.
I also am working on this short documentary, the Peyote Files web series, and I'm looking for funding and support in that, and also trying to make Chacruna organization, a nonprofit organization, and sustain our website that basically offers free knowledge. So that's also looking for partnerships in that realm.
More funding to Latin America, if you can. There are a lot of people that want to do a lot of studies there and get projects ongoing, and yeah, there's not enough attention in that area, I feel, so that could be good.
I would say give generously and give anonymously. Don't make it about you.
Well, I'm still a student, so I could use any funding somebody's willing to give me.
Okay, we're going to open up to the public. I also want to, remark on how the public has been so incredibly nice and, warm and interactive, and that everything flew in a very good, positive vibration with elegance. And thanks for the public too for, helping the conference be nice. So you can either ask to everybody or to one person, and you guys can self-organize how to go there.
Thank you all. First and foremost, I'm not a therapist. I'm not a healer. Ayahuasca found me. And I have had a challenge of how to now integrate that into my everyday life. If I posted a photo of even anything I've taken here, I would be called into HR and possibly fired. And this has been a part of my healing and service over the last 2.5 years. And I want you to know, first of all, that I've discovered out of Annie, your specific talk, that I actually was a victim of sexual harassment at one of those journeys, and that's why I'm still traumatized. So thank you for bringing words to that. And I just want to know, how do the ordinary folk give back in a way that could spread the word, spread awareness? And maybe that does mean I have to commit career homicide. I don't know, or suicide. But homicide, or both.
I think that's what's called a Freudian slip there. I think, one easy thing everybody can do is tomorrow and Tuesday and Wednesday when you go back to work and you're talking with some of your more buttoned up colleagues and they say, how was your weekend? Tell them where you were and tell them what you learned and tell them all the exciting things that are happening here. And, it's okay to at least out yourself as an attendee of a conference. You're learning, anybody can say, what they're learning. That's not, I have pretty strong feelings about people outing themselves in other ways too, because I think the more that we out ourselves, the more that we normalize this behavior.
I'm going to take another question, unless, Annie, go
May
ahead.
I just address really quickly the women who just stand up? I would also like to ask you to please find a good therapist, counselor, and healer to work with to address the incident that occurred to you, and then help other people find good healers and therapists to work with for their pain as well.
So the curanderos and the curanderas didn't need science in order to harvest, cultivate, dispense the medicines as they deemed appropriate. We now live in a modernity of science, where science is the authority, not necessarily the authority of traditions. My question is whether you believe that it's possible that the science of psychedelics, when imprinted upon the psychedelic experience, may actually obscure what the psychedelics were intended to do and what they are in their very nature.
Well, I do agree with the idea that what science does most of the time is trying to translate something into a language that we can communicate without the need of personal impression. That's a limitation of science, but science has its own power. It is indeed a very interesting way to motivate some of the direction that our society is taking. But by doing so, it does necessarily, and particularly in the case of psychedelics, will restrain a broader language into something that's a lot more restrictive than the language of the curanderos. And that's why I think that science has to talk with these other traditions to understand how can we translate that knowledge without harming the knowledge too much. But it's inherent of what science does. But we also have to acknowledge that a lot of the progress that we have seen for the past 300 years came from science. So we need to find a balance. Science is not a guru, but it's an interesting way to direct where we want to go as a society.
I'm a scientist, and I believe very much in the scientific method because I think it really is an important way to inform all of us in a language that many of us do understand, but it is only one way of knowing. There are many, many ways of knowing, and science is only just a piece of that. And so I think we need to value these other ways of knowing things as well. You know, one way of knowing is personal experience. Another way of knowing is tradition, and so all of those are so important. Otherwise, we can't reduce the human experience down to statistics and probabilities.
Mm-hmm. So I'd like to agree with that comment. And I'm a science journalist. I work with scientists in my day job. And I think that we should be having a larger discussion about what is science and who gets to define what science is. Mm-hmm. I want to live in a world of inquiry that includes traditional ways of knowing and does not allow science to be defined by FDA requirements or other institutions that may or may not honor equally different ways of knowing.
I'd just like to add that I completely agree, and I wouldn't just restrict it to, traditional use of psychedelics, not what they were only just, intended to be, but also what they can be. And I think we really need to look at ways in which we can just expand the possibilities of what these experiences might show us. And for that, we also need to include very much the arts. And how do we incorporate the arts into this discussion in a meaningful way, I think is crucial.
I think it's also important, too, to acknowledge the fact that these indigenous ways of knowing is indigenous science, and that indigenous science is valid, and it is now being recognized as a true science.
I was gonna, say something like that. I talk to a lot of shamans who consider what they do science. So maybe I wouldn't make such a sharp distinction between, what the shamans do and science, right? Because shamanism is very empirical. What they do, they've experimented. Maybe not in a lab, but they're experimenting on their own bodies, and they end up doing what works. So it has some commonalities with science, and people do refer to it as science. Right?
Got another question here.
So I'm curious what y'all think about the fact that the new face of mainstreaming is another older, wealthier, white person who's relatively new to these spaces, who largely excluded women and indigenous folks from his book, and who is still struggling to come up with coherent answers to some of the questions around that, despite being asked that at numerous public events. And I'm curious, given the fact that these dynamics are now encroaching into all of these other arenas, dealing with broader questions of capitalism and how we structure things in society, how y'all feel about the fact that he's representing these communities in a very public and visible way, while also claiming that he doesn't have expertise or isn't a leader, or however he might conceptualize that? It seems to me like there's a pretty significant shirking of responsibility and a lack of engagement with a number of critical questions by going that route. But that's my perspective, and I'd like to hear yours. And if it wasn't clear, that's Michael Pollan.
Hey, I'm just, I think the comment is welcome, but I feel that considering Michael Pollan is not here, I'm not sure whether, okay.
First of all, I'd like to thank Julie for asking him the question about why there were so few women in his book. Thank you. But look, Michael Pollan is a really accomplished writer and journalist. He's a very privileged white man. And I think he's in the position to help other people tell their stories. He has a lot of market clout, he has a lot of money, et cetera, et cetera. And I think that he can use his moment in the spotlight to help other people write their books, get their messages out, and have their truth heard as well.
I would argue that yes, he could do that, but what we have right now is really a white male narrative that celebrates the accomplishment of a small minority of people who've been involved in this for a really long time. And I don't think that we should celebrate that narrative that omits and erases so many important people, from the history of the psychedelic movement.
So I'll speak to how his book has impacted me on a very direct level, which is that we do these trainings for psychedelic integration. We've done about 11 of them over the last 3 years for clinicians. And the quality of the clinicians have changed in the last one we did about a month ago. There are people who were previously not aware of this work. And there are also many people in the public who read his book, who are now interested in experimenting with psychedelics, or who are recollecting experiences from the past, and they want support. They're going to their therapists or other people in their lives asking for help, or for guidance, or they're suffering and they want help. And what the impact of his book has been to bring greater awareness to people who are outside of this room, who do not know about Horizons, who do not know so much about psychedelics. There are people who are out there as therapists who want to help their clients, and now they're coming to us and they say, okay, well, so what do we do? How do we help these people who are coming out to us seeking for help? And I think that has been a positive effect. I really do. I know it's a complex issue, but that is what I've seen with my own eyes, and I appreciate that.
So, the thing I always say about Michael Pollan, I don't know how many of you are around, 10 years ago or something, 15 years ago, but all of a sudden, everybody was talking about grass-fed beef, and it was like, why all of a sudden is everyone talking about grass-fed beef? Like, what, and it turned out it was because Michael Pollan talked about it in a book of his. But everyone all of a sudden was talking about that. And then when he did Cooked, a lot of people were talking about probiotics and fermentation, how important bacteria was. And when I found out that Michael was doing a book on psychedelics, I was like, yay for us, because a lot of people are going to start talking about psychedelics and be sort of open to it. And, they trust him, and he's going to be talking about it in a lot of arenas. And, how many people watch Stephen Colbert that have no idea about psychedelics, and now they're like, that's interesting. It was, I considered him sort of like a bushwhacker, that he is helping to spread information. And obviously, no book is perfect. I will tell you, as an author working on my 5th book, and I really want to represent women and women scientists and researchers, it's hard to please everybody when you write a book, and it's hard to include everybody. And yes, I was disappointed that Maria Sabina didn't get more face time and other women didn't get more face time, and that I didn't, or Catherine McLean, or Mary Cosimino, a bunch of us were like, he referred to me as like somebody who worked with Stephen Ross, and I was like, that's not who I am. You can describe me 20 different ways. Somebody that worked with Steve. He and I both were at Bellevue, and he is my colleague. But and that's why when I introduced somebody, Sophia Korb, who's not here right now, but she was working with Jim Fadiman. I don't know if anybody heard me say this when I introduced her, as I was like, this is her work and her presentation. Yes, she works with Jim Fadiman, but I didn't want her linked with a man. So yes, there were problems with Michael's book, but overall. It's good for us. It's not bad for us. And it gets us talking more about what's missing, and that's great. But, it's easy to sit on the sidelines and say what somebody missed, and I will tell you, it's hard to write books.
I have to make one more statement here. So I think that perhaps both can be true. We can recognize that in many ways it is helpful for moving the psychedelic movement ahead, and at the same time we have to recognize that it does also promote racism and sexism.
I got a question here. Can you stand up, please?
Thank you for the, it's been great. Every presentation here, without fail, has been great. Thank you all. I do want to say that I have 30 years representing patients who are locked up in psychiatric centers against their will and forced to take medication. And one of the perspectives I wish I had heard more of today was from the perspective of people suffering from major mental illnesses who are benefiting from these psychedelics so that they're not burdened every day taking neuroleptics that poison their system and leave them zombies. Thank you.
You're actually reminding me, somebody asked me to please sort of plug ketamine or mention ketamine. It wasn't mentioned a lot this weekend, and you know, it has some downsides. It doesn't necessarily last very long, but it is legal. It is available. People can go and get ketamine treatments right now, as opposed to some of these drugs which are still Schedule I and we're still working on. But yes, there's, you know, this is why I'm saying that there's really a revolution in psychiatry, is that these are medicines that are less toxic, that can be used less frequently, that have better efficacy, and anybody who can spread that message, I get behind.
Some people out here may not know that there's also a rise in interest in ketamine-assisted psychotherapy. So there's the infusion approach, and then there's a lower dose approach with psychotherapy, and I don't think there's any clarity around the efficacy of it, but it's out there for other people who are interested to working in that way.
Good point.
I agree that the Michael Pollan publication has really ushered us into a new phase of this mainstreaming process. I would direct this question to Dr. Williams and Dr. Gorman. I was struck by the vulnerable sharing of Dr. Gorman's compassion from his experience in MT1. I'm wondering if we could sort of address the need for the years of people, younger people, looking to become psychedelic psychotherapists and are in clinical programs right now, and how can we support them, how can we lift them up, how can we get them involved at their universities conducting this research and not necessarily paying for an integration training.
Yeah, that's a great question. My vision is to have programs at universities everywhere where you can get a master's degree in psychedelic medicine. And if it's a program that I design, you will also at the same time be able to study multicultural counseling methods so that we can, again, expand this to everyone and have more people in the mental health workforce who are qualified to do this. So that's my vision, and I hope that people can get behind it.
I've got a question here.
Hi, thank you. I'm asking for any words of wisdom or support for those of us that are trying to bring this work to more rural or conservative parts of the country. So not in the big cities where we have established networks and psychedelic societies. So thank you.
There's also a colleague here, Mike Margolis. Are you here, Mike? If he can stand up, he's, you know, has an institution called Psychedelic Seminars, and one of the things they do is help people fund psychedelic societies in their hometowns, and he has a very nice program too. I encourage you to use him as a resource and pass the...
Teaching people in your local community how to use Narcan and naloxone to address the opioid crisis would be a great start, because it has impacted rural communities strongly in this country.
I actually live in a fairly rural environment now. I moved from the city up to a very small town, and there's about 8,000 people and 17 churches, and it's super conservative and not very diverse, and mostly Republican. but this is my community. My kids go to school with their kids, and I talk to the parents, and you just do it a little bit at a time, and you see where they're interested in. So, I know that cannabis is not a classical psychedelic, but it is sort of a minor psychedelic, and a lot more people have experience with it than other psychedelics, and sometimes that's a way in. But what what I end up trying to talk about are things like heart opening or mind opening, or having different perspectives, coming together, finding common ground. And just talking about DMT with somebody right off the bat is not going to be the way to go. But there may be some ways in, and everybody knows somebody who's benefiting from medical cannabis, even if you're out in the middle of nowhere. Like, you have a cousin who had cancer and chemo, and that could be a way in. That, that medicine helps, and it turns out that there's some other medicines that, also help.
By not vilifying them, that would be a good start, to recognize that that's in us as well, and that some of the views that are conservative are about family and tradition, and though we might be more, we may be greater risk takers, maybe respecting other people's, the pace that they may need to come to these things. And I speak to this in part because my father-in-law is very conservative. He's a judge, but he is also looking to help people to heal in this way. He's also a veteran, and he's very supportive of the work that, for example, MAPS is doing to help people who have PTSD. So I think we need to just continue to really stay connected and not get too caught up in this us versus them polarization that we're seeing all over the place.
Right.
And I would add that kind of we are human beings, and human beings kind of identify with other human beings, no? So kind of bringing a bit closer the human experiences or these transformations that people can go through film. So, perfect medium to do that, and kind of just also not just the science, but telling the human stories that are behind it very often inspire people and kind of break open their head a little bit more towards tolerance and curiosity.
And I do think that the veteran angle can often work when other angles don't.
Okay, everybody, I'm so sad to inform that our wonderful weekend is over.
I have one more. I will interrupt. I really want to, as a member of the audience, as a speaker, and as a board member of Horizons, I really want to thank you, Bia, and you, Julie, for the masterful job that you did this weekend.